Polio used to be one of the 6 killer diseases when we were growing up in the early 1990s.
Every year, on 24th October, was declared by the World Health Organization as Polio Day.
Now people are familiar with viruses because of COVID-19, Ebola, and among others. So like those diseases, polio is also one of the diseases which is caused by a virus called the poliomyelitis.
According to the World Health Organization, this year's commemoration will move under the theme, Together Let Us End Polio. Polio is a virus disease that is transmitted from person to person, mainly through the fecal oral route, or less frequently through contaminated water or food, and multiplies inside the tonsils.
This virus can be spread from food, what we call the fecal oral route, and therefore it means that if the food is contaminated by that particular virus, when a person eats that food, the virus goes into our digestive system. So when it goes into our digestive system, that is the first point of contact with the human. So it has an incubation period of about 9 to 10 days. Then it goes into our system. Mainly, it affects the nervous system. To our viewers, when we talk of the nervous system, we mean the system that is responsible for coordination of our activities, coordination of the body's activities, like speaking, walking, and those activities are mainly done by our what we call the musculoskeletal system, the muscles and the bones. So when we get the disease that affects the nervous system, it affects that particular system of the motor system or the musculoskeletal system. That's why people who get this polio, mainly the complication at the end of the day that we get is paralysis or inability to move. Why? Because the virus damages that particular system.
Before polio vaccine became available, several polio epidemics had occurred between 1948 and 1955.
In areas where it is endemic or where it usually exists, one of the commonest risk factor is hygiene, because when anything is to do with the food or the oral route as the method of spread of that particular disease, then hygiene conditions come in. Therefore, that's why it normally affects people in developing countries because of that mode of spread.
Dr. Nazir Rashid, the in-charge IUIU Health Center, revealed that this virus mostly affects children under 5 years because of their low immunity.
The biggest group that is under the high risk of getting this disease is the children below the age of 5. They are the ones that are mostly affected by this particular disease, and that is why the immunization programs that are intended to prevent the spread of this disease target people below the age of 5. Actually, it is among the vaccines that is on the national vaccination package that people receive when they're still below the age of 1 year. That shed from birth, actually, we give the first vaccine of polio, what we call polio 0.
According to Dr. Nazir, the virus spread through eating contaminated food and poor hygiene within community.
Earlier on, we said when someone eats contaminated food that has that poliomyelitis virus, the incubation period of about 7 to 10 days, where we said during that incubation period, the person may not show any signs and symptoms. So after those first 10 days, a child may experience some, we call them constitutional symptoms.
Among the signs of polio are body weakness, flu, fever, headache, among others.
That may not differentiate one disease from the other. Those symptoms that we usually get: fevers, fatigue, headache, vomiting. So in some other cases, if it is polio, we may experience stiffness of the neck.
However, Dr. Nazir revealed that the virus can be prevented through maintaining high level of hygiene for the drinks, its and vaccination.
Viruses don't have a definitive treatment. We usually do prevention. So for polio, we talked about its mode of spread, which is fecal oral route. And because of that, it means that the community must be on the alert that we cut off that transmission route by maintaining very good hygiene of our drinks and foods. Another method of prevention is through vaccination, to make sure that the vaccination of our children is up to date for all the immunizable diseases.
In line with this year's theme of the Polio Day, Dr. Nazir appealed to the public to join hands to end polio through immunizing children below 5 years.
Globally, the WHO puts in a lot of efforts to make sure that this disease is prevented so that we don't get many people with disabilities at an early age because of its permanent damage.
In an interview with some of the people from MBALE State who were affected with polio, called upon the public not to discredit those people with this ability. Some of the African countries which were mostly affected by polio are Benin, Burkina Faso, Cameroon, Central African Republic, Chad, Ethiopia, Liberia, Madagascar, Mali, Niger, Nigeria, mentioned but a few. Fahad Hamza Owere, Kamyuka Kenneth, Ibrahim Natiti, City Post TV.